Women diagnosed with breast cancer during their reproductive years often undergo harsh treatments that render them infertile. However, modern medicine has a solution. We want to welcome Dr. Andrea Peterson, Reproductive Endocrinologist at Coastal Fertility Specialists. Glad to have you with us. And we're talking about breast cancer awareness, and a lot of women, they get that diagnosis, that dreaded diagnosis, before they've even had children. So what is the alternative, the medical solution for women who are facing that?
Hi, I just want to say thank you so much for having me.
Of course.
Yes, and for patients who get that terrible diagnosis and they're young and they haven't started their family yet, or they don't feel like they've built the family of their dreams, a process is to freeze their eggs before they actually receive any type of cancer treatment. And there are different degrees of toxicity to the ovaries depending on what cancer treatment is used. There are a couple factors at play. We care about the age of the patient at the time that they're diagnosed. We care about what their egg reserve is. Mm-hmm. We care about what actual treatment is used, and then the dose and the duration of the treatment.
And you say that there are levels to toxicity when you undergo chemotherapy.
Yes.
And so of those degrees, is it ever safe to take a gamble and say, you know what, if I know what the toxicity level is and it's not that high, do I need to freeze my eggs?
Yeah, I think that's a great question. As I mentioned, you kind of take the whole picture into play, that patient's age, what is their egg reserve coming in, what type of chemotherapeutic agent would they be on. Some are more toxic to the ovaries than others. What is the dose and the duration of that? But the truth is that there aren't a lot of studies about what the impact is on the eggs after you've had a chemotherapy treatment. So the recommendation is usually to go ahead and do that fertility preservation before you're exposed to those toxic medications.
What entails the process? So you come into the doctor's office, you say, I want to freeze my eggs, then what?
Yeah, so really, it is a team approach. So, we'd like to talk to the medical oncologist, make sure that we get a sense of when do they actually want to start the treatment, and then regardless of what phase the patient is in their menstrual cycle, we would start treatment immediately. What that looks like is you would take injection medications for about 10 to 12 days. During that time, you're having ultrasounds and blood work. And then when deemed ready, you take a trigger shot, which allows for final egg maturation before you then have an egg retrieval, which is done under light anesthesia. Mm-hmm. And the eggs are aspirated and collected in our embryology lab and then frozen.
And is this cost prohibitive for some people? Is it expensive?
We try and keep our prices very competitive, but I would say it ranges from anywhere from $5,000 to $7,000. But if any patient wants more information, we'd love for them to schedule an appointment with us and talk about it.
And for how long can that last under those conditions?
Nowadays, we freeze the egg and it gets so cold that it essentially turns into glass.
Oh, wow.
And it can stay frozen for as long as...
Indefinitely?
Pretty much as long as we keep it under the right conditions.
That's incredible. Dr. Peterson, thank you so much for joining us. And for anyone who wants more information, go to coastalfertilityspecialist.com. We'll be back after this.